Most people aren't likely to have problems withdrawing from antidepressants. Why do I say that? Because that's what the data and the clinical experience show. A recent study that was just done, the meta-analysis of dozens of other studies, suggested on average 1 or 2 weeks after stopping antidepressants, patients had one symptom more, withdrawal symptom greater than the placebo group. Now, there are some people who do have severe difficulties withdrawing from antidepressants, so I don't want to minimize their distress. But for most people, withdrawal symptoms are fairly mild and consist of nausea, dizziness, sometimes weird tingling sensations, vivid dreams, and emotional volatility, so they're more easily overwhelmed. These are the common withdrawal symptoms from SSRIs. Usually these symptoms arise within a day or two after stopping medication and are gone within a week or two. Again, there are some people who do have problems for a longer period, and there are certain antidepressants, particularly Paxil and Effexor, so paroxetine and venlafaxine, which are more likely than other antidepressants to cause these reactions. However, what we know and I've always recommended is that people do not stop antidepressants abruptly. So you should taper over at least a 6-week period if you're on a normal course of antidepressants, particularly high dose, or you've been on them for a particularly long period of time. More than 6 weeks is often helpful. And I've helped hundreds of people stop their antidepressants with none of them running into serious problems. Following that regimen, there's even studies of people who had had trouble withdrawing, who when they went back on a much more slow, gradual taper, upwards of 90% of those individuals who had had trouble previously stopped their antidepressant medication without running into problems. Concerning that the people who promote that antidepressant withdrawal is a huge problem have a very skewed sample population when they're making this claim. And their claim is drawn from people they have recruited specifically because they have problems withdrawing from antidepressants. That can't possibly teach us anything about how common antidepressant withdrawal is.